Good afternoon. My name is Virgilia Abad. For those of you that don't know me, I'm a cancer survivor. So actually been like almost 2 years, 2 years since the first surgery. I already got all of my, chemotherapy, radiation, all of the treatment. I'm on the reconstruction surgery. But I want to share with you part of my, journey, my experience with immunotherapy and chemotherapy. So I got both of the treatment. So I got immunotherapy from the very beginning, the very first day of me going to the cancer hospital. So I went to the cancer hospital the very first day. So they put on me the immunotherapy, and they administered this through this port here that was made in the hospital. And so all of the immunotherapy, chemotherapy during 2022, they all were administered to me through the port that was done by a general surgeon at the hospital, okay? So now, the immunotherapy, every time that I was given immunotherapy, my energy levels, they were very, very good. I was energetic. I will come home and I will do all of my chores. Sometimes I might not even sleep. I feel so much energy. And so like almost every other day during the immunotherapy, I went for a walk, so I was doing some kind of exercise, moderate exercise, because I do have a double mastectomy, and I'm not supposed to do anything crazy like jumping or lifting weight, anything whatsoever. The max I could lift is like 3 to 5 pounds. As you can see, I still have I have lymphoderma. This is a condition after they remove all of my lymphatic nodes. Going back to the immunotherapy. So the immunotherapy is a very good treatment for your body. For me, so it was excellent, because what it does, it provides good information to your immune system to fight those cancer cells. And so while the chemotherapy, it kind of wash all of the cells from your body, good or bad cells. So the immunotherapy specifically go to eliminate those bad cells. It cannot help you to rebuild yourself. That's in my own word. Remember, I'm not a medical doctor, anything whatsoever, but that's what I understood. I try to understand even more, but I know that immunotherapy is something that really helps you. So it have less side effect. It is something that you should do, with your doctor, so you need to qualify for it. That's one of the things that I realized. To get immunotherapy, I was told that you have to have 2 centimeters of cancer. Mine was 2.5. By the time that I got diagnosed, was 2.5 within the preparation and the major surgery. Within a month, that cancer was so aggressive that it went from 2.5 to 4 point. That's pretty aggressive, okay? So then my oncologist, she decided to put the pre-authorization with my insurance for the immunotherapy. And I was given immunotherapy first every 2 weeks. And that immunotherapy was given to me, immunotherapy and chemotherapy, both, okay? So the immunotherapy was helping me to fight those cancer cells and to help me to rebuild my immune system. So now the chemotherapy, so what it was doing, it was eliminating all of the good and bad cells from the body, because it just wanted to make sure there was no residual after I got all of the major surgery. There was nothing in there that could compromise or spread in my body, okay? So some of the side effect of the chemotherapy was, for me, I did not get anything like nausea or anything like that. Some people might experience nausea, diarrhea, and things like that. I heard some other experiences from other people. But in my case, my heartbeat was very, very abnormal. Sometimes it was like over 100. It was so much. It was, so the activity level for me in my heart, it completely changed. That's one of the things. And of course, I was being monitored by my oncologist, by a cardiologist, and all the professional doctors, so to make sure that I will survive to those treatments, okay? So now, I couldn't sleep sometimes for like 12 hours, 16 hours, 18 hours. And after I was like come down from all of that chemicals in my body, the immunotherapy is helping me, of course, but it's a chemical in my body. So then I kind of come down and I started sleeping again, so I have to do sometimes some, tea, so just to help myself with the sleep because it gives me a lot of energy, okay? So now, the chemotherapy, it lower the energy level. The chemotherapy, so as you see some of my pictures, I'm gonna be showing them. Look at my nails right now, I can even paint them because it's been over almost 2 years since I have the treatment, 1 year from the treatment and 2 years from the double mastectomy. So all of my nails, they start changing color. That was with the carboplatin and the tassels. And I was using the, so the cold gloves, so you could see them. I'm gonna show you, so there will be a video about that, so that was preventing me from getting nerve damage because that's one of the side effects of the chemotherapy, carboplatin, tassel, that could give you nerve damage if you don't use those gloves. So you bet, some people, they have neuropathy for the rest of their lives. I thank God I don't have neuropathy in my hands. I neither have it in my feet, but I did lose all of my nails on my hands, and I lost all of my nails on my feet. I lost all of my hair. I lost all of the eyebrows, eyebrushes. Every place where I have hair was gone. And sometimes I was even bleeding through my throat, my nose, sometimes even my feet, so I did have to be very, very careful. I understand now why your immune system is so compromised and you have to be so careful while you are under this kind of treatment. And of course, you need to slow down, so doctors, nurses, they keep on telling me, so you gotta slow down because life changed and it changed for the rest of your life. So I've been like 2 years since I started this journey and I still not the same person. I try as much as I can with my nutrition and other things, but I still not the same person. I exercise, I walk, but I don't do none of the aerobic exercises that I used to do. I do a little bit, aerobics, walking and things like that, but nothing like lifting weights. I probably do maybe like 3-5 pounds, that's the max, and things like that, but no more than that. One of the things that I did, and please do to you that favor, if you were taking the treatment right now, or if you are planning to take the treatment, talk to your doctor and tell your doctor how you are regarding medication. Because you see, I myself, I was not good with any kind of medication, even Tylenol. If I take like 2 Tylenol, I was gone already. I have to go to sleep or something. So I talked to my oncologist. Instead of giving me 8 chemotherapy. So what she did, she split it in half and she gave me 16 chemotherapy, okay? And then she will do like the immunotherapy every 2 weeks, then she changes to every 3 weeks. So what happened with my body, it was better for me to assimilate that, and it also was better to survive to all of these treatment, okay? Those treatment help, but you know your body better than anybody else. Please talk to your doctor. Don't be quiet. Talk to your doctor, okay? So they will understand, So in my case, the reduced dose of chemotherapy was the best. Another thing that I do appreciate from my oncologist is from all of the chemotherapy. So there was carboplatin, tassels, adramycin. So she started the least hard chemo, which was the carboplatin and the tassel. She started with that, and then she continued with the adramycin, which is the hardest chemotherapy ever. That's why they call it commonly known the red devil juice. By the way, I do have a video about the red devil juice, and some people say that's scary. Let me tell you, it's not only scary, it's a reality. It's truly scary, okay? But in the meantime, so we have more chance to survive by doing all of the treatment than don't doing it. So one thing that I appreciate is that my doctor, my oncologist, all of the nurses, they were like with me while I was taking those chemotherapy, because they are really strong. You know, some days I feel like my head was coming off my body. I remember that day the nurses stayed right there with me. So when I was at chemotherapy number 11, I did all of my chemo and immunotherapy. I would just go and drive and go to the hospital, and I have my son, one of my sons going with me, Philly. And Philly, I just asked him, just come with me, just to see where I am. And if something happened, I cannot come back, you guys know where I am. The first 11 chemotherapy and immunotherapy, they were like that. By the chemo 12, life changed. I couldn't do it anymore. So when I got out of that hospital, my head, I was probably like 5 mileage away from my house, 7 mileage, but I couldn't think no more. I have to ask for help. So please do not hesitate to ask for help to your family, your friends, people from your church. You know, so in this journey, so I was humble, but I become more humble. And I ask you, please be humble, ask for help, because it's better to be safe than sorry. So, you know, so I do appreciate from the bottom of my heart all of the people that they work with me in this journey. And so until now, I'm still very grateful, you know, so my life changed forever. There are some days I have more energy, some days I have less energy. And I used to talk to people, neighbors, friends, that, you know, they probably went through the same situation like me, you know, so it's like I did not tell everybody I have cancer, but I selected good friends, good people to talk. And another things that I did was I made sure that I watched some video for meditation. Oh my God, this is like, it really works. So if you are not getting good sleep, if you're going through chemotherapy, immunotherapy, all of this treatment, or maybe reconstruction surgery like me right now, please go on YouTube, like you're doing right now, and check some of the videos for meditation, for sleeping, for inflammation. There is all kind of stuff in there, and that is going to truly help you. You know, so it helped me, it will help you as well, okay? So another thing that I will do was reduce my level of work. I was not going to my work like every single day, driving under the traffic and stress like that. No. Remember, cancer and stress, this is a bad combination, because the cells are going to multiply more if you are under stress. Then you need to reduce the levels of activity, okay? I understand you gotta work, you gotta make a living, so do I. So, but what is more important, your job or your own life? So that's what you need to think about. And God also provide, okay? So because I've been doing it from my house, sometimes I visit some clients. I'm an insurance specialist. I'm glad that I stayed doing that, because if I wouldn't stay doing that, I don't know how I would have survived to all of this, okay? So I will show you some of the videos of some of the effect that the chemotherapy causes, like nerve damage. That's one thing I mentioned, neuropathy, but also the nails, you know, they change color. The, you know, the feet, the toenail, they change. All of the hairs, all of that is gone, okay? So after a few months after chemo was over, I started getting all of that back, okay? And so I did not get diarrhea or vomiting, anything whatsoever, but I say that part of it is that I was able to do a very good breakfast every morning. I remember 3 eggs, organic, pasture-raised, and my juice before I went to that place. They will do the exams, everything, and I made sure that I have that good breakfast. They remember me for the breakfast that I was having in the hospital, because I remember if I'm gonna take medication, I had to have something in my stomach and good to seal my stomach. That chemotherapy is a very strong medication. It's about like 35 to 40 minutes pre-medication. So I was getting Benadryl, Ondenson, and some other medication that they are very, very strong. They also prescribe me, they say, if you need it. But thanks God, probably because I was doing my part, I was having my good breakfast in the morning and everything, and probably just my system. Remember, we're all different, so you probably react one way, some more people react some different ways and things like that. The point is get good nutrition, because so the whole thing is doctors want you to survive. I want you to survive. You definitely want to survive yourself, okay? So please, if you like this information, so make sure that you share with other people. They will thank you, they will love you for that. And don't forget to subscribe and like, okay? So have a wonderful afternoon, and I love you.